Good afternoon and welcome back to Channel 7 News. Tonight we have received insight from patients all around Colorado. There has been rumor about a recent outbreak of Bordetella pertussis, or as we know, whooping cough. Many hospitals have been avoiding the media. Today we will investigate what whooping cough is, how it works, how it spreads, and the possible treatments. Today we will begin by examining the structure. As seen in the picture, Bordetella pertussis is a gram-negative bacteria. It has been determined that it is coccobacilli in shape and is capsule. Contributing to its well-being, this particular disease is pleomorphic and requires aerobic respiration to thrive. Alongside all the basic characteristics, Bordetella pertussis gains virulence through production of endotoxins and exotoxins. Next, we will discuss how Bordetella pertussis works and what exactly determines its pathogenesis. Bordetella pertussis is known to create a rapid infection by colonizing and multiplying quickly in the mucosal membranes of the respiratory tract. Phase 1 strains adhere to the tuft of ciliated cells. Adherence and behaviors such as signs and symptoms are a direct reflection of the particular toxins released by the bacteria. Many of these factors contribute to the virulence as well. Tracheal cytotoxins, which together with endotoxins, destroy the cilia, making it difficult to clear thick mucus. Pertussis toxin caused by lymphocytosis inhibits the immune response and is unable to react to the Bordetella pertussis. As mentioned earlier in this segment, the bacteria has caused an outbreak in many hospitals across Colorado. The outbreak is caused by the easy transmission from patient to patient. Bordetella pertussis can live outside the body for several days. This illness is transmitted through direct droplet contact, making it highly contagious. Droplet contact entails a cough, sneeze, or poor hygiene that may transmit disease. A majority of transmission takes place when the host is in the catarrhal stage. Most symptoms are mild or non-characteristic during this time. Next, we will discuss signs and symptoms. Although Bordetella pertussis can be transmitted to anyone, it is most common in children from 0 to 6 months. For children and infants, whooping cough can be fatal. Bordetella pertussis has an incubation period of 7 to 10 days. Much of the transmission takes place during this time since signs and symptoms are very small. Bordetella pertussis can last anywhere from 4 to 21 days depending on the treatment given to the patient. Bordetella pertussis comes in 3 phases, the first being the catarrhal stage, the second being the proximal, and the third being the convalescent phase. After diagnosis, Bordetella pertussis can be treated. The most common treatment begins with antimicrobial prescription. Bordetella pertussis is usually treated with erythromycin. Supportive therapy, such as breathing treatments and frequent help from medical staff and family members, is extremely beneficial. It is also a good idea to increase nutrients and fluids during this time of illness. Lastly, rest as much as possible to enable healing. Although whooping cough can be treated, prevention is extremely essential to any disease. Immunization is the first step. Phase 1 of bacteria is used to create the vaccination. As of 1991, whole cell bacteria is no longer used to create the vaccines. Today's version is much safer and provides full protection. Vaccines given at age 2, 4, 6, and 18 months. Additional boosters can be given at any time. Boosters are especially recommended to travelers, children between ages 4 to 6, and expectant parents. Thank you for joining us for this segment on Bordetella pertussis. Please join us next week as we discuss new topics and new ideas.